Well, it's been 3 years since the Hannon Act was signed into law. It gives veterans struggling with their mental health access to potentially life-saving care. Now, despite the progress, nonprofits say there's still a lot of work out there to be done. Fox 43's Robert Stover shares what obstacles veterans still face.
The Commander John Scott Hannon Act, or Hannon Act for short, was passed by Congress and signed into law in 2020 for one purpose.
What it does to the Department of Veterans Affairs is it restructures how they do the mental health within the organization. It restructured how they did it. It expanded a lot of resources that were there and provided a lot more resources into the community.
Despite the positive impacts the Hannon Act made, Owens says veterans are still waiting more than a month to receive care.
I don't think anyone thinks 41 days for a wait time to see a mental health care specialist is okay.
Laura Mazzarini, program manager for Veterans Multi-Service Center in Harrisburg, says it could be due to veterans' lack of resource awareness.
That oftentimes means that veterans who do not actively and frequently access mental health resources typically have that longer wait time, because they're coming in as a new patient in sense.
According to America's Warrior Partnership, an estimated 17 million veterans live throughout the United States. However, only about 2 million access veteran care and resources. That number is lower across Pennsylvania.
These are their benefits. If they don't use it, it's not going to somebody else.
I would say that there's a good proportion of the veterans that we have the privilege of serving who say, I didn't know.
Mazzarini says outreach programs are critical to saving veteran lives.
The latest statistics show that veteran suicide rates are 1.5 times higher than the average rate for a non-veteran adult.
Robert Stover, Fox 43 News.